Spring definitely has come early this year, and you know what that means for a lot of people. It's going to be allergies, and not good. I'm joined by Dr. Rajan Merchant with Dignity Health Woodland. Doctor, glad to have you here. Since we're so deep into allergy season already, how would you rate this allergy season to the normal? Is this more so this year?
It's definitely an earlier season in terms of how high the temperatures have already gotten. The warmer the weather, the increase in the pollen levels, increase exponentially.
So in terms of when should people, let's say we call it, it's starting last week. When should people start on the Sudafed, if you recommend that, or what would you recommend? Allergy shots, all of that. What's your game plan?
Yeah, so typically for most individuals, we say start, getting ready for the season maybe a week or two prior to the actual temperatures warming up. Simple things that are usually helpful, changing out air filters, getting things like that ready, getting normal treatments like a saline rinse and a neti pot, all of those things that you sort of maybe stored away, getting those. And then medicines are typically, based on the symptoms and the specific, components that are being affected, eye drops, nasal sprays, antihistamines, they all work well for acute symptoms. There's some newer medicines that are combinations that are now available as well. And then ultimately, if symptoms are not controlled with all of those basic components or over-the-counter options, then seeking treatment, including allergy injections, which help to desensitize individuals.
So when do you know when you don't have it under control? If you're doing all the things you said, and then maybe even showering before you go to bed so the pollen's not on your pillow and all that kind of stuff, when do you just raise your hands and go, I got to go see Dr. Merchant?
Yeah, so typically I say if it's affecting sleep, school, activity, work in some way, limiting your ability to do your normal everyday activities, that's probably an indication that you're not managing your allergies as well as you probably can or need help.
So how do you determine if it's an allergy or a cold or something more severe?
Yeah, so there's a lot of overlapping symptoms. Runny nose, sneezing, congestion are very common among both allergies and colds. Typically for allergies, the symptoms can fluctuate a little bit more during the day, but based on the things you're doing. Sneezing and itchiness are more relevant for allergies. Fever, fatigue, maybe a little bit more relevant for colds and viruses.
Okay, so let's say we're into it now. When would you say you could start to see your patients tapering off and more end of the season?
Yeah, typically our seasons will probably go all the way through the end of June, typically July, before they start to come down. So once we hit triple digits for a couple of days, which hopefully nobody is wanting at the moment, even the allergy sufferers, I think we want to, keep the temperatures a little bit warmer or milder. But once we hit triple digits for a couple of days, that's usually when the levels start to come down.
All right, Dr. Rajan Merchant, thank you. Dignity Woodland, thank you, doctor. Stay well.